here we go. Your vertebrae, plural of vertebra, consists of 5 different types of bones. Mainly we discuss the cervical, thoracic, and lumbar vertebra, of which there are 7, 12, and 5 bones. The sacrum is important to remember as it supports and articulates with the hip, and the coccyx is your... We discussed for a good while the different curvatures of the spine, which provide a spring and flexibility to the support of your back and your upper body. First curvature is called the cervical curvature, followed by the thoracic curvature, followed by the lumbar curvature, followed by the sacral curvature. If we focus on this view, as viewed from the posterior, the cervical curvature is concave, followed by a convex thoracic curvature, followed by a concave lumbar curvature, followed by a convex sacral curvature. The cervical curvature develops after a baby picks up its head, thus is a secondary curvature. Thoracic curvature you are born with, thus is a primary curvature. The lumbar curvature develops after one sits up and stands and walks and puts weight on the back. Thus is a secondary curvature, and the sacral curvature you are born with. Scoliosis is the most common abnormal curvature. This would be viewed from posterior. The normal view from the back should be, the spine should appear straight from the rear, but in scoliosis exhibits an abnormal lateral curve. For the other two, we need a lateral view with an X-ray. And if we think of our lateral view, our normal curvatures again are concave, convex, concave, convex. For kyphosis, which is an abnormal thoracic curvature, the second curvature, the thoracic curvature, would be exaggerated. Get rid of this. And for a lordosis, which is an abnormal lumbar curvature, there will be an exaggeration here. So this is an abnormal thoracic curvature, specifically, and lordosis is an abnormal lumbar curvature, specifically. So this one is kyphosis, this one is lordosis, and the first one here is scoliosis. And these develop, we said, often as you, at least scoliosis, as you develop and grow, and one side of the body grows a little bit faster than the other side. The term you had to know here only was fibrocartilage, which is the tissue which comprises the intervertebral discs. This was a graphic of what a herniated disc might look like, which pushes out from its normal boundaries and can pinch one of these spinal nerves here and cause pain. General structures of a vertebra. The vertebral foramen is something to keep straight. It's the hole through which the spinous processes project posteriorly and transverse processes project laterally. Another foramen mentioned here, intervertebral foramen, formed by notches on adjacent vertebra. And these allow for the exit of spinal nerves. cervical vertebra, number is 7, easily identified by the presence of the third type of foramen, the transverse foramen, which allow for passage of blood through, and viewable here and here. The first cervical vertebra is called the atlas, and this has facets on which your occipital bone of your skull sits, and we call this the yes bone. When you nod yes, facets of the atlas. C2 is called the axis, and it forms a pivot for the rotation of the atlas and the skull. When you shake your head, no. And the pivot forms around this structure, which figures prominently in the axis. Following the cervical vertebrae are the thoracic, which number 12 due to their articulation with the ribs. And the three main ways you're going to distinguish a thoracic vertebra from a lumbar vertebra is the shape of the body, which in a thoracic vertebra is heart-shaped. The shape of the vertebral foramen, which in a thoracic vertebra is circular. And the shape and direction of the spinous process, which in the thoracic vertebra is sharp and points prominently downwards. In the next PowerPoint, we will thoracic vertebra and go over the ribs and the sternum.